Hi everyone, I want to talk about pressure ulcers best treatment. Best treatment for pressure ulcers. The first thing to do is know the tetanus shot status of this individual. Okay, and give antibiotics by oral or topical or both as the case might be. Treat any underlying cause or causes, and that will take us to a lot, and you can check my presentation on causes of pressure ulcers because I'll not be able to go over all of them here, like bedridden, wetting the bed or urinary incontinence, smoking, paralysis, malnutrition, anemia, stroke, depression, sharing forces, and pain, as the case might be. Then you have to go against the direction of the cause, like smoking, stop smoking. If medications are involved, stop the offending medications and discuss with the doctor who prescribed them. And of course, in case of malnutrition, you can let the dietitian be involved, or you just change the pattern from fat diet. And if there's problem with income that is the cause of your malnutrition, then discuss with the social welfare. Then adequate turning in case of bedridden. Whirlpool treatment is known in the olden days, but some centers are still using Whirlpool treatment up to now. Warm Whirlpools will increase circulatory system flow, thereby supplying blood or increasing tissue perfusion. And with more tissue perfusion, more nutrient, more oxygen is supplied to the region. And if that is the case, then you've gone against anemia, you've gone against ischemia, and the effect of peripheral vascular disease is overcome, then you have enough supply to that region and you can expect healing with the nutrients there. And it's also assuage soreness. I mean, it can lessen soreness, okay? And in case you need hydrotherapy for excessive debridement, then it's Whirlpool treatment. When we stage 1, you can just cover with Tegaderm because it's going to be superficial. So superficial ulcers are treated at stage 1 with Tegaderm. Stage 2, you can just use Duoderm because if it's non-exudative, then you don't need Xarogel. Xarogel is for stage 3 for exudative wounds and for slow. Those that form slow, you use Xarogel. Collagenase is going to be very useful for eschar, and you have to debride the wound very well. Like I mentioned the other time, when you are debriding the wound, you make sure it's pink. If it's not pink, you are not winning. Then while doing that, you need to irrigate copiously with normal saline or Ringer's lactate. And of course, it will encourage mobilization. For negative pressure wound treatment, is essentially that the foam dressing will be on the wound, secured with adhesive tape, and the unit will apply pressure to the wound bed. It will drain and remove infectious materials and can be continuous or intermittently every 5 to 10 minutes. Some people actually undergo special training for negative pressure wound treatment. You can have high density foam, which is better than the standard mattress. And you shift position every 15 minutes. And that is why many group homes will need more hands to help. And you can do complete physical examination to know if there are other comorbidities in this individual. And you need adequate history to rule out any possible cause or causes of poor wound healing. You can check my audio on poor wound healing or delayed wound healing. And I have a lot of them that would have covered HIV, malnutrition, anemia, medication like corticosteroids, disease-modified anti-rheumatic drugs, azathioprine, cyclosporin, collagen disease, and depression with psychosis or smoking. Then you have to do laboratory tests to include glucose to rule out diabetes mellitus and albumin. And when you have done all and you are not winning, or it is stage 4, where it has cut across the entire thickness of the skin, exposing the bone, the tendons, and joint capsule, referral to plastic surgeon will be expedient here. So kindly subscribe to my channel so that you can get these presentations immediately they are published. I appreciate it. Thank you.